All right, we went ahead and took the patient's vitals. They're all within normal limits. Hand hygiene, introduce myself, and then we're going to go ahead and start with the head to toe assessment. So at first we're going to inspect the skin for redness, discoloration, no discoloration present. And then we're going to go ahead and inspect the head for size, symmetry. We're going to palpate the scalp for any tenderness, masses. We're notating the hair color and distribution. No infestations are present. We're going to palpate the temporal arteries. Any tenderness?
No.
And then we're going to go ahead and palpate the lymph nodes as well. We're doing preauricular, postauricular, occipital, postcervical, anterior cervical, tonsillar, submandibular, submental, and the supraclavicular. So then we're going to move on to palpating the masseter muscle. If you'll clench your jaw, open, close. Any tenderness with that?
No.
All right, and then we're going to do the light sensation over the face. Can you feel this?
Yes.
This?
Yes.
This?
Yes.
And this?
Yes.
All right, sensation is present. We are going to make the patient smile, frown, puff your lips, puff your cheeks, and raise your eyebrows. Okay, then we're going to go ahead and move on to the ears. We're inspecting the ear shape, symmetry. We're checking these bilaterally. We're going to check the auditory canal. No redness. We would inspect the internal, and the tympanic membrane is intact. You would do that bilaterally. And then we're going to move on. We're going to palpate any tenderness.
No.
No masses are present. Then we will make sure this isn't turning off. Then we are going to assess the hearing. So if you'll go ahead and close one ear for me. Apple.
Apple.
You can hear that in that ear.
Yes.
And then you'll close the other ear. Repeat after me. Apple.
Apple.
All right. And then we would do the Weber test. Tell me if you can hear this on both sides.
Yes.
And then we would do the Wren test. Tell me when you can't hear it.
Now.
Tell me when you can't hear it.
Now.
Do that bilaterally. And then we are going to go ahead and inspect the eyes. So I am notating the lashes, brows, no drainage or discharge. I would, if you go ahead and pull your eyes down, check the sclera and the conjunctiva, pink, moist, no masses or anything present. And then I would pull the eyes up, checking that as well. Sclera is white. We would go ahead and check pupillary response bilaterally. They accommodate accordingly. Then we would do the vision acuity if we had a Snellen eye chart available. We're going to go ahead and move on to the extraocular movements. So if you will watch my finger and follow it accordingly. All right. And then we are going to move on to the nose. We're inspecting the structure, make sure it's midline and straight. We would check nasal patency. If you go ahead and close one nostril, breathe in, breathe out. And same on the other side. In and out. Nasal patency is present. And then we're going to go ahead and palpate the sinuses, so frontal and maxillary. Any tenderness?
No.
Okay. Moving on to the throat and the mouth, I would inspect the lips, teeth, tongue, pink, moist, intact. If we had a tongue depressor, we would check Press that and then pull your tongue up for me so I can check the palate. Everything is expected. We would palpate for TMJ. So clench for me, open, and clench. That is not present. Then we'll go ahead and if we had a tongue depressor, we would push the tongue down, say ah, checking for uvula response. We're going to go ahead and move on to the neck. So we're checking for color, no discoloration, no lesions, no masses. We will palpate the trachea, midline, no shift. Then we would palpate the thyroid gland as well. Look back for me, swallow. And then we would check the carotid pulsation. We would do one side at a time. And then we would go ahead and do range of motion of the neck. If you'll go ahead and extend back for me, chin to chest. You'll do your ear to your shoulder, each side, and then shake your head no. Perfect. So we'll move on to the chest. Just for privacy reasons, we're going to keep the shirt on, but we would inspect the skin, discoloration, integrity, any sort of edema or anything like that. She is in no current signs of respiratory distress. So we would check symmetry, symmetric, no obvious deformities. I would check chest expansion, front and back. I'm going to go ahead and listen to the lung sounds. And we would check for tactile fremitus on the front as well as the back. I'm going to go ahead and move on to the back. You're listening for a full breath on each landmark. And then for tactile fremitus, you will repeat after me, 99.
99, 99, 99.
Perfect. And then expansion, you would check there, take a deep breath in, deep breath out, and it is symmetric. So moving on to the heart, I'm going to go ahead and auscultate all 4 landmarks with both bell and diaphragm. So aortic, pulmonic, tricuspid, and mitral. Then we would flip, same landmarks. And while we are at the point of maximum impulse, it's the apex of the heart, we're going to go ahead and listen to the apical pulse. You would do that for a full minute. And then moving over that, we have the apical, pulmonic, tricuspid, and mitral. And then at this point, I would ask the patient to lie down as far as we can in this situation. Then I would inspect any heaves or lifts while the patient is lying down. I'd probably go ahead and listen to the heart tones and those same landmarks. Both bell and diaphragm. And so from that point, I'm looking for any signs of jugular vein distension. There are none present. We'll go ahead and move on to the abdomen. I'm going to inspect, as always, the skin. We're going to keep the shirt on just for privacy reasons. There's no redness, lesions, masses, discoloration. I'm checking for symmetry and contour. Abdomen is flat, symmetric. Then I'm going to go ahead and auscultate for bruits. We're going to do this over the aorta to start. Then renal. Then iliac. And femoral. And we're doing this to assess for bruits. And then I'm going to listen to bowel sounds as well. If we had time, we would do it for 2 minutes in each quadrant. And if you felt that the bowel sounds were absent, you would do it for a full 5 minutes in that quadrant. And then I would move on to percuss each quadrant. We'll go ahead and palpate for any masses or tenderness, any tenderness. And then we'll palpate for the liver and spleen. If you'll take a deep breath in, palpate right upper quadrant underneath the rib cage, liver. And then for the spleen, same on the left, you should not be able to palpate the spleen if it's not enlarged. And then at this point, we will go ahead and sit back up, and we are going to assess the upper extremities. I'm going to inspect your hands, any tenderness, no redness, no edema noted. We're also checking the upper extremity for discoloration, edema, none present. Then we are going to go ahead and check capillary refill. You would do this bilaterally in each finger. And we'll go ahead and check radial pulses. So bilaterally you would do this. Then we are going to visualize the upper extremity. Like I said, no edema, no discoloration, bilaterally. I'm going to go ahead and palpate the elbow, any tenderness, no masses are felt. If you'll go ahead and squeeze bilaterally, hand strength 5 out of 5 bilaterally. Then we'll go ahead and check wrist, no masses, any tenderness. And then I'm going to get you to pull against, flex against towards you. Go. And then pull down. Okay. Strength 5 out of 5. As far as the elbow range of motion, we are going to pull against, towards you. Perfect. And then you'll push down, down. Perfect. Strength 5 out of 5. And then for bicep, tricep, we would notate the strength on that as well through what we just did. If you'll pull towards you and then push down. Perfect. And then we're going to test the shoulders against resistance if you'll shrug for me. Perfect. And we're going to do range of motion if you'll just stick your arms out to the front, all the way up to the side. Perfect. And then moving on to any tenderness with the shoulders, not with that range of motion. And then we're going to move on to the light touch of the upper extremity. So you would do this bilaterally. If you'll close your eyes for me. Can you feel this? Yes. Can you feel this? Yes. Can you feel this? Yes. Perfect. We're going to go ahead and do, if you'll hold your hands out for me, keep your eyes closed. Tell me what item is in your hand.
A bottle cap.
And then keep your eyes closed.
A pen.
Go. If you'll keep your eyes closed for me, I'm going to draw a letter on your hand. If you can tell me that letter.
S. L.
Perfect. So that's checking for the neurosensory response. And then we're going to go ahead and do the deep tendon reflexes. You would start with the brachioradialis, come down the forearm, hit like that. And then we're going to go ahead and check the bicep and tricep. Perfect. If you'll go ahead and touch your thumb to each index finger for me, and we'll do the rapid movements. If you'll put your hands and flip-flop them as fast as you can. Perfect. If you'll put your arms out for me, finger to nose, one at a time. And then if you'll just pick up the speed. Perfect. So then we're going to move down to do our deep tendon reflexes on the lowers. I'm going to go ahead and check the patellar. If you'll scoot back as far as you can. Perfect. And then we would do Achilles. Perfect. And then we'll go ahead and stay on the lowers. We're going to inspect skin, any discoloration, any edema. There's none present. We would check the toes, skin on the feet, capillary refill. You would do that bilaterally. Along with the deep tendon reflexes, you would do that bilaterally. And then we are going to palpate the ankles, any tenderness.
No.
Okay. We would check pulses. You can relax your feet. Dorsalis pedis, post tib. You would do that bilaterally. And then I'm going to go ahead and do light touch. If you'll close your eyes for me, tell me if you can feel this.
Yes. 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 Yes.
Perfect. And then we're going to go ahead and do the vibration sensation. We would do this on the lowers. We'll come back up to the uppers. Can you feel this?
Yes. Yes.
We'll go ahead and check the uppers as well.
Yes. Yes.
Okay. Then we'll go ahead and do the strength of the lowers. If you'll push against me, perfect. And if you'll pull up towards you, perfect. We're going to check the strength of the knees as well. If you can try to pull this towards you, perfect. And then push towards you. There we go, you do that bilaterally. I'll go ahead and get you to stand. We're going to check range of motion in the hips. I'm going to go ahead and palpate any tenderness.
No.
Okay, and then if you can abduct for me. Perfect. Can you adduct? And then we'll go ahead and do that on that side as well. Perfect. And then can you raise your knees up for me? One at a time. Perfect. Range of motion is acceptable. Then I'm going to go ahead and get you to walk straight on the line for me. We're going to check your gait. Okay. Turn back. And then I'm going to go ahead and get you to bend over and touch your toes for me. I'm going to inspect your spine. So spine is midline, straight, any tenderness.
No.
Okay, this is when you would check for scoliosis. You can go ahead and stand back up for me. We're going to test Romberg. So if you'll keep your hands by your side, feet together, look straight ahead. There's no swaying present. Go ahead and close your eyes. Also no swaying present. And then we're going to hop on one foot. I'm not concerned about her safety, so I'll go ahead and get her to do that one-footed. Perfect. Go ahead and have a seat for me. And that wraps up the head to toe assessment.